How do thyroid antibodies affect my fertility? Imagine your immune system as your body's security team, always on the lookout for threats. Sometimes, it mistakenly targets your own thyroid gland, producing antibodies like antithyroid peroxidase and antithyroglobulin. These are signs of thyroid autoimmunity, which can happen even if your thyroid hormone levels are normal. This condition is called euthyroid, meaning the thyroid is functioning properly, but the immune system is still causing trouble. Research shows that having these thyroid antibodies can make it harder to conceive. One way they do this is by disrupting your menstrual cycle. They can cause irregular periods or even stop ovulation altogether, which reduces your chances of releasing a healthy egg at the right time for fertilization. When ovulation is irregular or absent, it becomes more challenging to get pregnant naturally. Thyroid antibodies can also impact your ovaries. They are linked to a decreased ovarian reserve, meaning fewer eggs are available, and the quality of those eggs may decline. Lower quality eggs can lead to fewer viable embryos, making conception and successful pregnancy more difficult. Additionally, these antibodies might influence the environment inside your uterus. They can make the uterine lining less receptive, which means the embryo has a harder time implanting properly. This can increase the risk of early pregnancy loss or miscarriage. Women with thyroid autoimmunity also face a higher chance of miscarriage, especially if their thyroid-stimulating hormone levels are at the higher end of normal. Even if your thyroid hormones are balanced, the presence of these antibodies can still pose risks. They may cause immune-mediated damage not only to the thyroid but potentially to reproductive tissues that express thyroid-related antigens, further impairing fertility. During pregnancy, the situation can become more complex. The thyroid gland might not respond adequately to hormonal changes caused by pregnancy, such as human chorionic gonadotropin stimulation. This can lead to insufficient thyroid hormone levels at a critical time for fetal development and pregnancy maintenance. In the context of endometriosis, which already hampers fertility through inflammation and anatomical changes, thyroid autoimmunity can add another layer of difficulty. The combined effects may further disturb hormonal balance, ovarian function, and the ability of the embryo to implant successfully. Managing this involves regular monitoring of thyroid function and antibody levels. If thyroid dysfunction is present, treatment with thyroid hormone can improve fertility chances. However, if only antibodies are present with normal thyroid hormones, the benefits of treatment are still being studied. It's essential to work closely with a healthcare provider to develop a personalized plan. In summary, thyroid antibodies can interfere with fertility by disrupting ovulation, decreasing the number and quality of eggs, impairing the uterine lining, and increasing the risk of miscarriage. If you are experiencing fertility challenges, especially if you have endometriosis, it's important to have your thyroid health evaluated as part of your overall fertility assessment. Always consult with a healthcare professional for personalized advice and care.